Hi, my name is Marley Reynolds. My vulnerable population was veterans, and I am assessing their environmental and cultural factors. So, cultural environment throughout the media, I feel as if veterans are highly respected. Some stereotypes may be that they're just old and male, when in reality, veterans can be any age, gender, race, ethnicity, etc. Many are physically disabled, others suffer from mental health disparities such as PTSD or depression. There can be misconceptions about what kinds of veterans need assistance. These are not just a geriatric age. The biggest thing for veterans is they need family support. This can be whether that be either attending medical appointments, those with physical disabilities, they may need help with activities of daily living in their own homes. Others can be through social support, whether they're going through depression or anxiety or PTSD. Family can be there and help them through counseling. They can also provide financial assistance for housing and food. And also mental health counseling and medical needs. This can greatly impact the health outcomes of veterans as they need support in order to succeed. Peers can play a big part in their culture environment as well. They can be supported by providing help where needed. This can include, again, transporting to medical appointments, aiding financially or socially. Peers can also, on the negative side, be degrading by bullying for being different from the crowd. By choosing who they surround themselves with, veterans can either have supportive relationships or destructive relationships. This is with anybody as well. The cyclical nature. Veterans may experience PTSD after deployment. They may pass off some of these PTSD symptoms to their children. This can include anxiety and depression. It can also run in the family. After deployment, veterans may need time to adjust to home life, and it may have an effect on their family as well. The legal and political system. So, veterans in the legal system, those who are incarcerated or in jail, are at high risk of opioid overdose and death. This is consistent throughout the nation. The legal system hinders veterans when they are in jail as they are at a high risk for substance abuse. Potential barriers. Veterans do have a stigma of being masculine. This may deter veterans from seeking help. Sometimes being emotionally vulnerable can mean that you're not masculine. So mental health stigmas may make it so they're afraid to ask for help. This can also be detrimental with suicidal and depressive thoughts. This can be a sign of weakness, so people may not seek help. On an international scope, U.S. veterans are not really respected by the opposing country at war, obviously, and then they may be shunned by other countries that are with the opposing sides. In some countries, violence and war are frowned upon, and in other religions. Then this can make it hard to seek help in other countries if needed while deployed. Socioeconomic status. So, low socioeconomic status is correlated to poorer outcomes after hospitalizations for medical issues. This may put veterans at a disadvantage by not being able to afford proper housing or food. And then veterans of higher socioeconomic status are at an advantage because they can afford healthcare, screenings, counseling for their mental health disparities, things like that. So race and ethnicity. Racial discrimination can lead to poor mental outcomes in veterans. Unfortunately, it's very prevalent in the Army. Minority races are at a high risk of experiencing PTSD in the military, and also anxiety and depression. This could be due to bullying or other things like that. Negative mental health outcomes can have poor effects on one's physical health as well. So, religion. Veterans who are more religious are less likely to commit suicide. There can be several reasons for this. This could be that their religion discourages suicidal thoughts or behavior, or that they use their religion to cope with their suicidal thoughts or behavior. Religion can also be a source of peace and coping in one's life, and it can also be better for their mental health. LGBTQ and gender minorities can experience discrimination in the military, just like all minorities. Females are also a minority in the military, so they can experience discrimination. This again can lead to PTSD, anxiety, and depression. Gender diverse veterans are more likely to experience other health disparities, such as cardiovascular disease, COPD, diabetes, and substance abuse. Gender diverse veterans may not have equal access to the healthcare resources they need. I think that this could be a huge step in going forward, where we can make everything equal no matter people's gender. Geographical location. So veterans in rural areas may not have equal access to healthcare as opposed to veterans in larger cities, just because there's less hospitals, clinics, and things like that. Telehealth can benefit veterans in rural areas so they can gain access to medical appointments and care, and it makes it so they can access their hospital and doctor no matter where they are. So implicit biases of veterans, implicit biases of veterans may have mental health instability. This can be a negative bias that people may subconsciously feel about veterans. And then an explicit bias, this is a bias that the general public often consciously notices and says out loud, is that veterans are more stoic and rigid in their emotions. On an international scope. So internationally, there are regions of this world where disparities would have less influence on the health of veterans. This can include countries not affiliated with the US or any other countries that are at war with them. This could be because there's no bias around veterans, because it is not relevant in their country. They're just another person there. Veterans could become a part of the general population in other countries where military does not exist. And here are my references. Thank you.